Hi, I'm Myra Evangelista. I'm going to present to you our proposed evidence-based intervention, daily nursing-led family meetings. The purpose of this study is patterned to the formulated PICO questions. For families with critically ill patients, what is the impact of daily nursing-led family meetings on patients' outcomes and family satisfaction? The study aims to assess the impacts of nurse-driven daily meetings in terms of family satisfaction and patient outcomes of critically ill patients. The background of the study is grounded on the current reviews and surveys of Ascent Hospital, which showed patients and families' frustrations and anxiety due to inadequate information and knowledge about their loved one's critical condition. It has been assessed that there is an apparent poor communication between the families and healthcare providers in the ICU. Review on the selected literature showed the gaps in communication and inadequate knowledge about patients' condition are identified as the primary reasons that resulted in the unfavorable outcomes and less involvement of families in critical care. Nurse-directed care that centers on family and patient communication are consistently the core interventions applied among the selected literature. The study has come up with the finding that a nurse-led, patient and family-centered intervention such as daily nursing-led family meeting facilitates the provision of constant and updated communication with patients and their families. Thus, daily nursing-led family meetings is found to be effective in promoting both patients' family satisfaction, outcomes, and overall well-being. Results in the review of selected literature showed communication is the primary and key intervention that improve family satisfaction and achieve the provision of quality care. Nurses are unanimously identified as the frontliners in the initiation of patient and family-centered care that is directed towards the provision of constant communication and adequate information to the patients and their families. For the conclusion, it has been determined that the provision of adequate information and constant communication about a patient's medical condition are found to be the essential intervention and the utmost needs of the families of critically ill patients. Additionally, it has been determined that nurses are the leading healthcare professional who are the most capable of providing adequate information, moral, and emotional comfort to families of patients with critical condition. Therefore, the implementation of a daily nursing-led family meeting in ICU of Ascent Hospital could fill in the existing communication gaps and consequently improve both patient and family satisfaction, outcomes, and overall well-being. It is recommended that a nurse-led family meeting facilitators team is formed to facilitate the approval, dissemination, and implementation of the proposed intervention. After gaining approval, it is advisable to conduct a 6 months practice run to assess and determine the applicability and feasibility of the proposed interventions. It is also recommended that when the proposed interventions are approved for full implementation, a post-survey on the same outcome indicators will be conducted to comprehensively follow the effectiveness of the interventions. The implementation of daily nursing-led family meetings redefines and emphasizes the core objective of Ascent Hospital that is directed towards the provision of excellent and quality care. In this regard, a full implementation of the proposed intervention in all medical units of Ascent Hospital would bring in high quality care that promotes a better outcome of the overall well-being of all patients and their family. This ends my presentation. Thank you so much.